Good afternoon, everybody, and thank you for joining us for a COVID update for Indian River County. To date, we've had a total of 85 people in Indian River County that have tested positive for the virus, and the vast majority of those people continue to isolate at home. This is a cumulative total since the beginning of this event, not those that we have not 85 active cases we have currently in the county. The supply chain for protective equipment to the hospitals, long-term care facilities, and adult living facilities continues to be robust. We continue to deliver those materials, personal protective equipment, to the hospitals. We made two large deliveries this week to both the Sebastian Hospital and the Indian River Hospital, as well as most of the nursing facilities throughout the county. We continue to have daily discussions with our local municipalities, our law enforcement chiefs, the sheriff's office, and county fire rescue to address countywide needs and consolidated actions for the health and safety of all of our residents. Again, I'd like to thank all of our participating agencies and municipal partners for their input and cooperation during this time. It's truly been a team effort countywide. In a recent news article, there was criticism about the release of specific information and locations of COVID-19 cases throughout the county. There are a number of federal laws, and I want to emphasize federal laws, and requirements that restrict the release of this type of information. Any information that could be used to track the identity of the patient or the location of the impacted patient could and can be considered a violation of HIPAA laws. We will not do that. There are a number of agencies that I would like to continue to thank that are meeting the unmet needs and unseen needs throughout the community. Those include the American Red Cross, Salvation Army, Source, United Way, just to name a few of those. We are saddened to announce the second COVID-related death in Indian River County. Our heartfelt sympathy and support goes to the family during this incredibly difficult time. This was a 90-year-old male that had no travel history prior to this incident. At this time, I'd like to turn it over to the sheriff to give us a briefing from the sheriff's office.
Thank you, Chief. Thank you, others. Thank you, Mr. Brown, our county administrator. Obviously, this is a health-related crisis, but the law enforcement component obviously is near and dear to law enforcement folks in this room. I want to thank the community for their patience. Sincere thank you for behaving as we've asked many times. Please know that your county leaders are in touch with each other as we opened this operation exactly a month ago on March 17th, and here we are on the 17th of April. We also know that you're frustrated with a lot of things, to include some of us, school being closed since the 23rd of March. We're in this together. We're in it for the long haul. We are still taking people to jail, contrary to what you may read. In fact, fortunately, our inmate population is down about 50 points, from 529 to 472 today. You may hear things in other counties about sheriffs letting inmates out of jail. That will not happen in Indian River County. Please understand that there are victims to every crime. Whether it's a possession of cocaine charge, that's the state of Florida is the victim. If it's a domestic violence, we're certainly not releasing those types of individuals. I will tell you, if you have a loved one in Indian River County Jail, there's a three-step process that we go through for he or she that's been arrested to make sure they do not have the virus. Additionally, I'm proud to report that we do not have any cases of the virus in the county jail. We look forward to our continued relationship with patients. We're going to get through this without a doubt in our mind. We think we see some things ahead. So be calm, relax, and thank you for your patience.
Thank you, Sheriff. So statewide, as of 11 o'clock, there are 24,119 cases with 3,507 hospitalized and 686 deaths. As Chief Stone had mentioned, the current number of our cases is 85. 30 of these are travel related, 53 have no travel history, and 2 are unknown and under investigation. There are 23 people with a history of hospitalization. The age range of our cases is from 8 to 94, with 46 men and 31 women. As Chief Stone had mentioned, we now have 2 deaths, one in an 88-year-old female and one in a 91-year-old male. In terms of race and ethnicity, 5 of our cases are black, 58 are white, 13 are classified as other, and 1 is unknown. For ethnicity, 4 individuals are Hispanic and 62 are non-Hispanic, 11 are unknown. And that unknown category is, there's no data in that category recording on the form, the testing form. We have had 9 COVID-19 cases in residents or staff at long-term care facilities and 1 death. The health department is dedicated to providing public health support to our vulnerable populations, to our assisted living facilities, and to our nursing homes. I can tell you that we are in constant communication with these facilities, and we are providing education and information on infection control and environmental cleaning. We have done extensive outreach in Gifford, Wabasso, and Fellsmere to provide education on COVID-19. We've partnered with the NAACP in many of these outreach efforts, including with our faith community. All of our cases are either self-isolating at home or isolated in the hospital. And I know I say this each week, but I want to encourage all Indian River County residents to stay home and only go out for those essential trips. It's especially important for those people who are over 65 or those that have chronic health conditions of any age. These people should stay at home as much as possible and minimize interactions with others. Maintain your social distancing of 6 feet. Frequently clean your hands. Wear a cloth face covering in public areas like grocery stores or pharmacies. I know that we hear this every single week that we talk to all of you, but it's important to think about it because we have our normal habits every day, and it's walking up to people, it's talking to people. You're in close proximity, but you have to think about maintaining that 6-foot distance. It's critical. Testing is available through Cleveland Clinic and Indian River Hospital drive-through testing site and the health department for those meeting DOH criteria for testing. So our health department criteria and what we're limited to for our health department itself is limited to healthcare workers, first responders, patients in long-term care facilities with symptoms, people 65 and older with symptoms, and people with underlying conditions with symptoms. The health department has done 53 tests. We currently have the capacity to perform 248 tests. The total tests done in Indian River County are 1,230 with 64 pending. 1,145 are negative and 85 are positive. There are call centers, which I mentioned before. The Department of Health has a call center in Indian River County at 794-7411. That's active Monday through Friday, 8 to 5. DOH call center is in place 24/7 to answer questions. That number is 1-866-779-6121. And of course, we have our County Emergency Information Center, and we're sincerely appreciative of those individuals answering those phones to answer resident questions. And at this point, I'd like to turn things over to Corey Richter for a report on the hospitals.
Thank you, Miranda. Both hospitals, as we've said, each time we have this, they're fully prepared. If you plan on visiting either one of the hospitals, both hospitals are really limiting the visitors, and I would suggest you go to their website to see what the up-to-date criteria is to get in. I know Sebastian is doing 100% mask on everybody, patients, doctors, nurses, visitors, so they're trying to do everything to protect their clients in-house from contacting anybody who's been with COVID-19. So their website, sebastianrivermedical.org or indianrivermedicalcenter.com, and get the latest on what you need if you have to visit somebody in the hospital. Now, as far as testing, Sebastian Hospital has tested 62 total patients. 55 of them have been negative. They have only 2 pending at this time and 5 positive from Sebastian. Cleveland Clinic, their hotline, they have taken 4,339 total calls on their hotline. It's a lot of calls in the last few weeks. They've tested a total of 1,206 that they've tested. Negative, they've had 1,085. They have only 62 pending, and out of that positive, out of their 1,206 that they've tested, 59 have been positive. The The good thing in some of those numbers, if you've been noticing week to week, the pending numbers have been going down, which is a good thing, meaning the testing results are getting back quicker now, so they're having less, because they're still testing about the same almost every day. We're not looking at that exactly, but we know the pending numbers are going down, which is good. So the testing results are getting back quicker. They're able to treat the patients more appropriately rather than being a pending. So right now Indian River has 10 in-house patients. That is maintained the last couple days, and we're hoping that number goes down too in the next few weeks. But and I think that's all I have for that. Anybody have any questions? Did you get all the numbers this time? I tried to say it slow enough. All right, then I'm going to, Jason Brown, County Administrator right now.
All right, thank you, Corey. Good afternoon. Thank you all for being here. While we have continued to see an increase in COVID-19 cases, Indian River County has not seen increases as significant as other areas of the state. That is great news, but it in no way is a reason to let our guard down. This relative success shows that our social distancing seems to be working, so we need to keep doing what we have been. I want to thank all of our Indian River County residents for doing your part and following the governor's Safer at Home order and the health department's recommendations. These things have been working, and again, our Indian River County residents, as they do during hurricanes or any other type emergency events, have been following these guidelines and going above and beyond. So thank you, all county residents. I know everyone is eager to put this event behind us, but we need to make sure that we finish strong. Yesterday, the White House issued guidelines for opening up America again. These guidelines will provide direction to the state and the counties to begin getting back to normal as conditions warrant. We have been conducting the planning for this. However, we are not ready to do so yet because that will be as conditions warrant. And I want to emphasize that getting back to normal will be a new normal. We will not be returning to activities like they were prior to COVID-19, but we will get back to our new normal, and we will get there. I want to thank county residents for your patience, your sacrifice, and your cooperation during these challenging times. I would also like to thank our first responders, including our firefighters, paramedics, our law enforcement officers, from the sheriff to the city PDs. I would also like to thank our healthcare workers, grocery store employees, truck drivers, restaurant workers, our cities that have worked with us, our partners such as the health department and our hospitals, and all the citizens who have been doing a great job to help us respond to COVID. Thank you, and we're available for any questions.
Hey, Jonah. I had a question for Miranda.
Yes.
Do you have the date that the 91-year-old man died? Or...
That case was counted on the 16th.
Oh, okay. Is that the date that he died, or?
I'm not providing the date that he died, but the date that case was counted was the 16th.
Oh, okay, gotcha.
Yes.
And going off of Nick's question,
Sure.
you said earlier that was a man in an assisted living facility, is that correct?
I said that I did not specify that. What I stated was that there were 9 cases in assisted living facilities between the staff and the patients,
Right.
and that there was 1 death. I didn't specify that who that was.
The death was, so you can't confirm whether or not it was in an assisted living facility.
Correct. I can confirm it was within the staff or the residents of an assisted living facility.
But 1 death is tied to an assisted living facility.
It's within the staff or the residents of assisted living long-term care facilities, yes.
Thank you.
Yep.
All right. Anything else for today? All right, thank you all very much.
Thank you.